And now for the dark side of retinoids. Retinoids can damage your skin barrier. Vitamin C can oxidize before it even touches your face. And peptides, most people don't even know what they do. And one of these is silently aging millions of faces. And by minute 5, you'll know exactly which one most people are using wrong. Hi, I'm Dr. Linda Brand, medical doctor and aesthetic clinic owner. I review skincare using evidence and real patient results. No filters, no brand contracts deciding my opinions. Today, you'll learn what these ingredients actually do in skin, who should use which one, and which combinations work, and how to avoid destroying your skin barrier. And at the end, I'll show you the routine I use on patients with mature skin and after device treatments. Chapter 1: How skin actually ages. Before we start comparing ingredients, you need to understand what aging actually is. Because aging is not just wrinkles. After 40, collagen drops about 1% per year, your barrier thins, recovery slows, and that's why aggressive routines start backfiring. And this is why one of these 3 is often used completely wrong. Chapter 2: Retinoids. Retinoids are vitamin A derivatives, but they don't all work the same. Oh no, they have to convert in your skin to become the active form retinoic acid. Think of it as steps. The fewer steps to retinoic acid, the stronger the effect, and the higher the irritation risk. When reading the ingredients list, look for the exact retinoid form. Retinol esters are gentler, retinol is most common, retinol is stronger and often a better anti-aging choice. Tretinoin is prescription only. You're looking for retinol palmitate, retinol acetate, retinol propionate. These are all retinol esters. Then you can look for retinol, retinal, or retinaldehyde. And if you have a prescription, tretinoin or retinoic acid. If the product just says vitamin A, that's not enough. Retinoids are used at low percentages, so they often appear mid-list. However, if it's very far down, last 5 ingredients, it's likely a weak marketing amount. Supporting ingredients, because barrier matters. For dry, sensitive, or mature skin, look for ceramides, cholesterol, fatty acids, glycerin, hyaluronic acid, panthenol, niacinamide. For dry, mature skin, I prefer retinol, but carefully buffered. And now for the dark side of retinoids. They disrupt lipids and increase transepidermal water loss. And this translates to, yes, you're right, dryness, irritation, and burning. The ingredient silently aging millions of faces, it's not retinoids. It's retinoid overuse on a weak barrier. Let's have a look at what is the truth. Stronger does not automatically mean better. Truth number 2. Irritation is not the goal. Peeling is not progress. Burning is not collagen. And redness is not anti-aging. Chronic irritation actually damages the skin barrier. And long-term barrier damage can accelerate visible aging. Truth number 3. Tolerance determines results. The best retinoid is the one you can use consistently for years. Not weeks, years. A moderate strength retinol used 3 times per week will outperform an aggressive formula you quit after just 2 months. In my clinic, most overtreated skin comes from retinoids, not from peptides, not from vitamin C. Retinoids are powerful, but they are aggressive. And here's the part most people don't know. Retinol is the strongest retinoid you can buy without a prescription. It only needs 1 conversion step, 1, to become active. That makes it more efficient than retinol, but usually less aggressive than tretinoin. Retinoids are powerful, but power without control is damage. And the goal is not aggressive skin, we don't want that, it's resilient skin. Peptides don't push, they signal. Chapter 3: Peptides. If retinoids are a hammer, peptides are architects. Peptides are short chains of amino acids. They act as biological messengers. There are different types: signal peptides, carrier peptides like copper peptides, neuropeptides, and enzyme inhibitors. And if you haven't watched my peptide video, you can look for this video. What they do: they tell fibroblasts to produce collagen, they support wound healing, they reduce inflammation, and they improve barrier proteins. Peptides do not exfoliate, they do not thin your skin, and they do not cause irritation. But in long-term studies, skin quality improves, elasticity improves, and tolerance improves. Let's talk about peptides, because this is where marketing gets loud and the science gets quiet. Most people think peptides are weak, or useless, or just expensive filler. Truth number 2. They are slow by design. If you're expecting overnight glow, peptides will disappoint you. But if you're thinking long-term skin quality, they make sense. Collagen signaling takes weeks. Barrier repair takes consistency. Peptides are subtle, but subtle is sustainable. Truth number 3. They're barrier friendly. Peptides do not thin the skin. They don't disrupt the barrier. They don't increase sun sensitivity. So that makes them ideal for 40 plus skin, especially when using retinoids or devices. And combining peptides with retinoids correctly can actually reduce irritation by up to 40%. Chapter 4. Vitamin C. Vitamin C is L-ascorbic acid, or a derivative. Its main job is to neutralize free radicals, reduces the damage of oxidative stress caused by UV light. It also helps collagen synthesis, it reduces pigmentation, and it brightens skin tone. So what are the problems with vitamin C? It needs low pH, it can oxidize extremely easily, it can irritate sensitive skin, often unstable, and they can smell of hot dogs or campfire. This is the one from Drunk Elephant. C Firma Fresh Day Serum. Absolutely wonderful, but the smell. Oh my gosh. You guys, this smells like campfire, and the smell doesn't disappear. Stays with you all day long. Vitamin C should be used in the morning, and once opened, try to finish it within 3 to 6 months actually, because this is especially true for L-ascorbic acid. If it turns dark orange or brown, it's oxidized. Stop using. What to look for in the ingredients list for vitamin C. Look for the specific form of vitamin C, not just vitamin C. You want to see the exact derivative name. There are 8 common forms, but only 3 really matter for most people. That would be 1, the L-ascorbic acid. It's most common in high potency serums. Number 2, sodium ascorbyl phosphate, very common in acne and sensitive skin formulas. And number 3, magnesium ascorbyl phosphate, common in gentle and brightening products. And supporting ingredients to look for: vitamin E, tocopherol, ferulic acid, antioxidants, barrier ingredients. These improve stability and tolerance. Position in the ingredients list: top 5 ingredients equals meaningful concentration. Bottom third is likely decorative. For L-ascorbic acid, effective formulas are usually 10 to 20%. For derivatives, concentration varies, but if it's near the bottom, expect minimal impact. For vitamin C, packaging is important, especially important for L-ascorbic acid. It needs to be airless pump, opaque bottle, minimal light exposure. A dropper bottle plus clear glass equals oxidation risk. Let's talk about the truth about vitamin C, because not all vitamin C are the same, and most people don't know that. When someone says this has vitamin C, that actually tells you almost nothing. First, number 1, the form matters. There isn't one vitamin C, there are multiple forms. Pure L-ascorbic acid is the strongest. It works fast, it stimulates collagen, it brightens, but it also irritates the most. Then we have the derivatives. These are more stable, more gentle, but slower. Truth number 2, stronger is not always better. If your skin barrier is damaged, a strong 15% L-ascorbic acid serum can actually make things worse. So stinging does not mean working, redness does not mean collagen. Truth number 3, the vehicle matters. Water-based, low pH L-ascorbic acid formulas need acidic environments. That increases irritation risk. Oil-based THD formulas, they are more stable, often better tolerated, and especially for mature skin. For dry, sensitive, mature skin, I usually prefer THD ascorbate. It's more stable, lipid-soluble, and doesn't require a low acidic pH. L-ascorbic acid absolutely works, but not every skin barrier can tolerate it. Chapter 5. Head-to-head comparison. Let's be very clear. If you want fast, visible change, retinoids win every day. If you want glow, vitamin C helps. If you want your skin to age slower over 10 years, peptides matter more than people think. Chapter 6. Who should use what?
Acne-prone teens.
Retinoids.
Outdoor lifestyle.
Vitamin C plus sunscreen.
Post-procedure skin.
Peptides.
Mature skin.
All 3 actually, but carefully, and always remember SPF. Chapter 7. My routine. For my AM routine, I start with cleansing, and at the moment I'm using the Estee Lauder Advanced Night Cleansing Gel with 15 amino acids. Or I'm using La Prairie Foam Cleanser. So it's one of these I'm using at the moment. Or if I'm a little bit lazy, I'm using the Garnier Skin Active Micellar Cleansing Water all-in-one, because I do a really good cleansing in the evening. So some mornings I feel this is enough. It's so easy to just grab this one. But I try to do the full cleansing also. Then I start layering with peptides. And I'm using the Medicate Liquid Peptides Advanced MP. Then I follow up with vitamin C from Medicate C Tetra Advanced. And sometimes when my skin is very dry, I use the Haro Wonder Black Rice Probiotics Barrier Essence. And as a moisturizer, I'm using Paula's Choice Pro Collagen Peptide Plumping Moisturizer. And if you don't have SPF in your moisturizer, remember to add an SPF cream. So I'm using the Chocobo, this is a Korean company, the Bio Watery Sun Cream SPF 50 PA++++. And this sits also really nice underneath makeup. If I need more moisture for my face during the day, I always bring with me the Alba First Spray Serum. This is so delicious. Let me just show you. All I do is spraying it on like this, and it's so nice. It really freshens you up during the day. My PM routine. So for cleansing, again, I'm doing these two. I usually don't do a double cleanse because my skin is too sensitive for that. It doesn't like it at all. Then I do exfoliation 2 to 3 times weekly, and I'm using the Beauty Bio Swipe and Glow Peel Pad. They contain AHA, BHA, PHA, and a niacinamide. Easy peasy. And then I'm using peptides again in the evening, and again the Medicate Liquid Peptides Advanced MP. Then I'm doing retinoids 5 to 7 nights weekly, and I alternate between tretinoin and Paula's Choice Pro Retinaldehyde. This one. This is my absolutely favorite if you want a retinaldehyde. This is really good. Then I add my wonderful essence again from Haro Wonder Black Rice Probiotic Barrier Essence. And for PM barrier support and moisturizing, I'm using these two from Estee Lauder. It's the Advanced Night Repair plus Revitalizing Supreme Plus Youth Power Cream. The best ingredient is the one your skin tolerates consistently. For years, no single ingredient fixes aging, strategy does. If this helped, like and subscribe. Next video, Peptides Part 2. See you then. Bye.